This is Scott Becker with the Becker Private Equity and Business Minute podcast. Thrilled today to be joined by Matt Wolf. Matt is one of the great leaders at RSM, brilliant in the healthcare valuation space and the healthcare space. He's going to talk to us today a little bit about ChatGPT and AI in healthcare and a lot more. Matt, take it away. Tell us what you're watching with ChatGPT in healthcare and so forth.
Thanks, Scott. Happy to discuss. It's obviously been getting a lot of attention and focus in the media, and we think there's some great applications now that we're kind of watching and tracking. And there's also a lot of hype too, and I think we should talk about the overhype part as well. But in terms of the cool features, one of the solutions we're really excited about at it's kind of a Microsoft solution that we're actually definitely looking at a little bit too with a lot of our clients is how do we use ChatGPT to summarize and help physicians interact with inbound patient messaging. The inbound patient messaging has exploded since the pandemic began. Once we moved to a virtual health kind of environment, patients discovered that they actually had patient portals and they had a way to reach out to their physicians and send a lot of messages. That can take a long time, especially in aggregate for physicians to decipher and then respond to, right? As patients, we're not experts at explaining our symptoms or even what we're trying to accomplish by interacting with that physician. For example, I saw one example where it was a voicemail that, and this is like in a demo environment, but a patient had left for a physician that was very long, 300 or 400 words long, and basically was just asking, can I walk through TSA security with a pacemaker, right? And so ChatGPT was able to read that message and prompt the physician and say, okay, here's what I think the patient is asking about. Here are some related links and studies related to walking through a screening service with a pacemaker. And here's sort of a drafted response that the physician can then edit and obviously make sure is okay. And send on to the patient. And this can reduce the time it takes for a physician to respond to an inbound patient message from 17 minutes or so on average down to about a minute or two, and still provide high quality insight and advice that is always reviewed by the physician, just kind of helping with some of that initial legwork. And we're excited about this, not only because it'll help physicians better interact with patients, but also reduce burnout. Physicians are spending hours every night responding to these messages, and it's really burning them out. So we're excited. That's one thing that we're excited about.
But that's fascinating. And you could see this, like none of us a couple of years ago would have texted or messaged our physicians. Now, if we do it once in a while, we know the rest of the world does it once in a while. And by the time you're done with it, it's a lot of different texts and messages. It's almost like, you're a professional services person. If you went back 30 years ago, you got very few emails. And now getting down to email zero is a constant struggle. And so much of it's just junk email. Whereas from a doctor's perspective, he or she's got to answer every one of them in a way that doesn't cause trouble and doesn't cause a malpractice problem, and is responsive to the patient, and often can't bill for it. So what a challenge. So what else are you seeing out there like this that you're excited about? Because that's fascinating and needed.
Yeah, and I think other applications would be around clinical documentation, prompting clinical documentation or better understanding clinical documentation. Again, I think the important thing for healthcare is to understand that it shouldn't, at least in its current state, ever be used sort of hands-off, right? Always to augment the clinical activity or improve the clinical activity. But ultimately, that clinical activity needs to be the responsibility of that clinician. But wherever we're talking about billing, coding, or other clinical documentation exercises, including prompts, think back to like, Clippy, right, from old school Microsoft Word, Microsoft Office, kind of popping up and saying, "Oh, it looks like you're, treating a patient or triaging a patient with X. Like, here, have you considered documenting this, that, and the other thing?" Helping to improve not only the revenue cycle, but then also just the care that patient receives, right? If we have better clinical documentation, help improve outcomes. So that would be another of the kind of the key main areas that is exciting. And part of as I mentioned before, one of the limitations, we want to leave this in the hands of the clinicians, is that ChatGPT kind of works like almost seems like magic, right? You can ask it any question, you get all these responses that, at least at a surface level, look really good and it's interesting. But it's important to note that these models are basically statistical, large language, machine intelligence driven models that don't actually know what they're talking about, right? They kind of study language and study information in a way that they can put together responses that appear good, that have a lot of good information, but they don't actually know anything about medicine the way a human knows things about medicine. So we have to be very, very careful and cognizant how we deploy these technologies. And we think that there are ways that they can really help improve patient experience, patient outcomes, help reduce clinician burnout, and help just kind of ease a lot of the tensions and frictions that exist within the healthcare system. And certainly on the non-clinical side too. I mean, there's a whole host of applications there. But we have to be careful and understand the limitations of the technology as well.
And how long is it till you start to see serious adoption of some of these things by providers, by physicians, by health systems? What are you starting to see, and how long till it starts to have a positive impact, hopefully, on sort of the ability to provide care more efficiently? What's your sense of that?
Yeah, I think it's going to come down to the use case. So something like using ChatGPT to summarize inbound patient messages, that's a pretty readily available use case, right? That's something that can be done soon, that people are very excited about and are already implementing in some cases. For other applications, that it's going to take a longer time, right? Before we see sort of like chat bots or other more science fiction-y types of applications of ChatGPT. So it's going to be varied. And I think, where we should see it adopted first are in sort of these clinically adjacent settings, or certainly more in the back office, kind of administrative functions, the non-clinical settings. But I think we're going to have to see it move pretty quickly, just because providers just don't have a lot of, especially in healthcare and other industries are in the same way, right? Just don't have a lot of other options. There's still very low unemployment, difficult to find the right mix of labor that we need. And so we need whatever sort of technological edge we can deploy, as long as it makes sense, in order to continue to meet whatever sort of patient obligations or business goals we're trying to meet.
100%. I mean, just to take care of the 330 million people in our country, if we don't do some of this stuff soon, we're not going to be able to take care of it. Matt,
absolutely.
I want to do this. I want to thank you for joining us today. And I'd love to maybe update this conversation maybe in a month with what you're seeing and what you're hearing about deployment, and how quickly some of the acceleration actual use is happening. Some of this stuff is just needed. And if it could do everybody complains about EMRs from a doctor perspective, just because of the extra amount of time it's taken them to process things per day. There's incredible studies on how much hours are spent on all this documentation work. Would love to see some of these things actually get to work deployed and take some of the load off of our physicians and nurses, and fascinating to watch that. And we'd love to have you back on in a month and maybe talk about what you're seeing.
Absolutely. I mean, a month from now, it could look very different, the rate at which these language models are developing. There's a great study out there. If anybody's curious, you can just Google it and find the differences between initial versions of ChatGPT 1, 2, 3, 3.5, and then 4. They ran these language models through all these various standardized tests. And you can just see, especially between 3 and 4, the incredible leap on the scores that the models have achieved on advanced placement tests, the LSAT. Scott, you should look at the LSAT scores that this thing is getting. It's incredible. And I mean, all these models have just come out and replaced each other in a matter of months. So next month, we'll have a lot more to talk about, I don't doubt.
Matt, I want to thank you so much for joining us today. Thank you very, very much.
Thank you, Scott.